Good afternoon. I'm going to call to order this meeting of the Public Health, Environment, Civil Rights, and Engagement Committee. I'm the committee's vice chair, and I'll be facilitating our meeting today. Chair Cunningham is out of town, and also Councilmember Kano won't be with us. We have 4 items on our agenda. The first is a public hearing on the nuisance odors ordinance. Second is the consent item on the agreements with Xcel Energy to purchase renewable electricity from the Renewable Connect program. Third item is a report presentation from the Health Department on family and early childhood work. And the fourth item is our report from our Minneapolis Workplace Advisory Committee. First, I will move our consent item and see if there's any questions anybody has on that. That has to do with the agreements with Xcel to purchase renewable electricity from the Renewable Connect. Seeing no questions, all those in favor, please say aye. Aye. Any opposed? That motion carries. And then we'll move on to our public hearing. This is on our odors ordinance, and there's some amendments that have happened to the ordinance and are proposed, and we'll have a hearing on that. But before the hearing, we'll have a brief presentation from Jim Doughton, our Environmental Services Supervisor. Welcome.
Thank you. Good afternoon, Vice Chair Gordon, Vice President Jenkins. I want to talk to you here today. My name is Jim Doughton. I'm the Supervisor of Environmental Services for the Minneapolis Health Department, and we're here to talk about proposed amendments to the nuisance odor law. And what I'm going to do is have a short presentation about it. It's fairly straightforward, fairly simple, so we'll get right into it. So odor, as you're aware, is one of the most complex senses that we have, and it can trigger some pretty strong emotional responses, either positive memories or negative associations. And so one of these things it does is it also clouds what people's opinions are on it, what bothers them and what not. It makes it a very complex issue for regulation. Odors are considered a local issue. They're not regulated under the Clean Air Act by the EPA, and the MPCA previously regulated odor from 1970 up to 1976 when the law was overturned, and under an unusual thing. A judge told them that unless you have a reason to put it back in place, we're not going to let you, and it's going to be a local issue. So it's a local issue. The MPCA does regulate hydrogen sulfide and VOCs, which are a lot of the odor contributing components that cause health effects, so they do maintain that. Counties, by and large, regulate feedlots in the city or in the state, but municipalities are left to address nuisance odors. Current state in Minnesota, where we're at, is that it is a public nuisance. As you can read here, and the bottom line is to look at that is that we have a reasonable person standard, which was something that was in effect for across the country. But what is a reasonable person? I think I'm reasonable. But the other thing is that with the second part of that, on top of that, having a reasonable person, is that the odors that came out had to be at a certain level that would offend that reasonable person for 30 minutes coming off across there. In our search, we're the only city that I found across the country, a jurisdiction that had a 30-minute standard. And that's for the reasonable enjoyment of the property is a standard nuisance law. People react differently to different smells. We have different tolerances, and it can be a very subjective issue. What you like is not necessarily what I like. And we have to judge odors by what their level are, not whether or not we like them or not. We treat them all the same. But what is bad? Currently, it said what is a reasonable standard or reasonable person. What we currently do is we have what's here. I'll get into it just a little bit. What's called a nasal ranger, field olfactometer. And we basically follow or use an SOP that establishes what's good and what's bad. That's what we use to define what the reasonable person is. Try to make it objective standard. As I mentioned, this is the nasal ranger. It's a field olfactometer. It's a concept that was originally developed by the Public Health Service back in 1958 through 1960. They came up with a thing called a centometer, and it had very specific ratios of clean air to dirty air that came on in. And they did studies, and they came up with that 7 dilutions of clean air to 1 part dirty air constitutes a nuisance hazard. And that's what you see consistently in laws across the country now. And that it said it's dilutions to threshold. What that means is that's the first time you can detect an odor. So at 7 dilutions, you can just whiff it. Doesn't mean you can identify what it is. That's called recognition threshold, where you can actually see or smell what it is. And one of the other things with this is that may seem kind of strange, but you and I smell differently. And how do we know that we're being consistent? What our standard is that every 6 months, our staff that use this actually have to get their noses certified. And it's kind of awkward having a blindfold on and sniffing pens, but we are trying to make sure that all our people are smelling within the range that's considered normal. So every 6 months, all our staff has to be certified, and as well have to be trained in the field, hands-on, performing the test to make sure that we're doing it the same way every time and that our people are smelling normally. And here we are in action out at a park in northeast Minneapolis. As you can see here is also our policy, not only to use certified noses and training on the olfactometer and doing it in the field. We have 2 people as well. So we get 2 independent readings and make sure that what we're getting is consistent. As I said, the current ordinance states that we had a obnoxious odor basically coming off for 30 minutes, and it's interfering with your property, use of your property. What we're proposing to do is change that standard to incorporate what we're using anyways in most places that are across the country are also incorporating the nasal ranger or the field olfactometer, and we're seeing it at 7 dilutions, and we're getting 2 readings at least 15 minutes apart within 1 hour. So we're getting our standard down from 30 minutes down to 15 minutes, which is consistent with other laws across the country. Another proposed change that we have further on down is that what is an obnoxious odor? We have it as an obnoxious odor. We're saying that that is the definition of 7 DTs as defined under 47.150. And one of the points of compliance we're looking at, instead of taking consideration where the nearest human habitation is, we're advancing it to incorporate the concept of where we live, work, and play. And so we're proposing to change that to a point of human activity. So it might be park, public space, not just at a residence. So in summary, what we're trying to do is define what is a reasonable person, using the field olfactometer to update our standard to be consistent with other municipalities and jurisdictions across the country. Change the point of human habitation to point of human activity to be more consistent, update our ordinance to address the goals of the city. And changing the odor duration, what constitutes a violation, from 30 minutes down to 15 minutes. That concludes my presentation.
Thank you very much. Very informative. Any committee members have any questions? Seeing none, then I will open the public hearing. Is there anybody here who's wanting to speak on this issue today? Anybody at all? Seeing nobody stepping forward, then I'll close the public hearing. And on the proposed ordinance amendment, Councilmember Johnson.
Thank you, Mr. Chair. Mr. Doughton, actually, if I could ask you to come back. I know when working on this ordinance, I was interested in the health risk values being a part of this. I know there's been ongoing discussion
Yes, sir.
with the Minnesota Department of Health about that. If you could just give us a recap of where that's at.
Yes, appreciate that bringing it up, Councilmember Johnson. Council Gordon, where we're at, the health risk values or health risk limits are set by the Minnesota Department of Health, and these are actual chemical concentrations in the air that are trying to be protective of human health. It's kind of like how dirty is dirty, and they're actually putting a number to it to a specific compound. What we're looking at is incorporating the HURL, the health risk limit, into the odor ordinance to, if we see that would also be a violation of the nuisance odor act or nuisance odor. We're in the process. There's some very fine points in there about what the standards are: acute, chronic, and subchronic. And so we're talking to the Minnesota Department of Health right now about what that means, what would constitute violation, where we would be comfortable, and through our attorney's office as well, where we would be comfortable with that would be appropriate for us to incorporate into our nuisance standard. That's where we're at right now. We've got a proposed change right now, ready for Joe Fussy to review, but also to get feedback. We're waiting for feedback from Minnesota Department of Health on those particular points, and that we will address that separately.
Excellent. Okay. And I guess, Mr. Hanlon, I see you here as well. I know we didn't get a chance to connect right before committee on this, but I'm wondering if there is an openness to delaying a cycle on this in order to try to get that in there, or were you interested in completely going back and reopening and doing another round of it? Because I'd love to get that in there. I think it would be excellent.
Chair Gordon, Councilmember Johnson, thank you for bringing this issue up. My name is Patrick Hanlon. I'm the Director of Environmental Programs. We would prefer, because we're not sure how long this review is going to take, from talking with the Minnesota Department of Health, the Minnesota Pollution Control Agency, in trying to come up with what those standards would look like. I'm not even sure if, delaying it to the next round, if we're going to be able to come to a consensus by that point. This is, there's not a lot of precedent to be looking at other jurisdictions who are doing that kind of work. So I would love to say that we can come back and have a decision by next round, but I don't know if we're going to get there with the two agencies that we're working with. And so from a staff perspective, I would prefer if we could put the odor ordinance separate and then try to move forward with the other aspect on a different schedule.
All right, I appreciate that. Thank you.
Thank
So,
you.
Mr. Chair, I'll go ahead and move these changes to the ordinance.
Okay.
And thanks, staff, for all the time and the work together on this. I really appreciate the partnership, and I look forward to working with you on the poorly named acronym HURL, making sure that we get that in there. So, thanks.
We'll work on it, sir. Thank you.
All right, so there's a motion before us to approve the ordinance as amended. Any discussion or further questions on that? Seeing none, then all those in favor, please say aye. Aye. Any opposed, say no. That motion carries then. Thank you very much. That will move us on to our third item, and this is a report from the Minneapolis Health Department on our family and early childhood efforts. And leading us off in that report will be Patty Bowler, Director of Policy and Community Programs. Welcome.
Thank you, Chair Gordon, and good afternoon, committee members. So I'm going to be talking about our family and early childhood work, and also be asking you to think about how you might support this work. We have some specific ideas, but I want to take a moment and just introduce a couple of special guests. So with me today is Alicia Stanzel, and Alicia, I'm going to just wave. Alicia is a Healthy Start participant, and a little bit later on in the presentation, she's going to share her perspective on intensive home visiting and Healthy Start. Also with us today are a number of staff from the Family Partnership, and the Family Partnership is a longtime community contracted partner. So we have Carolyn Hood, Betsy Bartek, and two case managers, Valencia and also Emily. And then I also wanted to introduce our family and early childhood staff. See, we have quite a crew here. And so Kristen Theraldson is the Healthy Start coordinator for our department, and Stephanie Graves serves as the senior public health specialist working on family and early childhood health.
Well, it's wonderful to have you all here and really appreciate all the good work that you do for the residents of our city or participate in. So we have quite a vision for how our families should be
served in Minneapolis. And here's our vision here. Infant mortality is a thing of the past. All children and families are healthy and thriving. They're in safe, affordable, adequate housing. They're nurtured in a non-toxic environment. There's healthy family involvement for all children and school readiness for all children. So that's our vision. But let's look at the reality. We know that about 27% of children in Minneapolis are living in poverty. We also know that infant mortality continues to be a problem, and that Black mothers, the rate for infant mortality for Black mothers is about 3 times that for white mothers. There were about 1,400 homeless children in Hennepin County, and that adverse childhood experiences plague over half of our population, 55% of adults. And of those 55%, 15% of adults are experiencing 5 or more adverse childhood experiences. So I just want to define this briefly. Adverse childhood experiences are a complex set of experiences that are shown to have negative or adverse health or social implications. And examples can include child abuse and neglect, whether it's emotional, physical, or sexual, just basic neglect, and growing up in a seriously dysfunctional household as evidenced by witnessing domestic violence, alcohol, or other substance abuses, mental health issues, suicidal family members, parental marital discord, etc. And the reason that they matter is that they can result in high-risk behaviors, social and cognitive implications. They can manifest themselves in chronic disease later on in life, so they might be a factor for hypertension or diabetes, and they result in early death. So what is our health department doing around family and early childhood work? We spend about $3.65 million on an annual basis. And you can see the pie chart here of our investment in family and early childhood health. A good portion of the work, about 65%, is dedicated to family home visiting. But I'm going to cover kind of 4 buckets of work that our health department's engaged in. The first one is thriving babies or improving birth outcomes. The second is culturally based programs. The third is school readiness, and the fourth is teen pregnancy prevention and teen parent support. All right, in terms of thriving babies, as I mentioned before, we have quite an investment in providing early intensive home visiting. And when I say early, the goal is to reach families before the baby is born and continue that relationship 2 years, sometimes even 4 years out from the birth. Family home visiting can result in fewer preterm deliveries, better birth outcomes, fewer moms using tobacco or other substances, more children breastfeeding, higher immunization rates, parents who have a greater understanding of child development. And then what I think is great too is the home visitor oftentimes help with those social conditions of health like housing, employment, education, financial literacy. And we provide these intensive home visits through contracted partners. And last year in 2017, we provided visits for about 3,000 families. And to us, that seems like a big number, but you should note that that's about 15% of the eligible families. Oops, I meant to go back. Now is where I'm really screwed up because I'm not very technical. Never mind, it's okay. We also provide WIC services, that's nutrition education and supplements to about 3,000 families per year. And then lastly, Healthy Start. I wanted to mention Healthy Start. It's a federal grant that we've had since about 1999. And the whole goal is to reduce infant mortality. And our focus is African American births. I mentioned that statistic where the infant mortality rate is about 3 times higher. The goal of Healthy Start is to really provide case management, wraparound services for women who are at risk for poor birth outcomes through home visiting programs. Our partners are Minnesota Visiting Nurse Agency, or MVNA, which is now part of Hennepin Health, the Family Partnership, they're here today, North Point Health and Wellness, and also we have a fourth community partner that provides inpatient mental health services and outpatient mental health services to our Healthy Start population. So I just wanted to pause my presentation and ask Alicia to come up and just talk briefly about her experience with Healthy Start.
Welcome.
Good afternoon. My name is Alicia Stansel. I've been a part of Healthy Start maybe almost 18 months now. I started with them when I was about 7 months pregnant. I was just moving back here. I was going through it to a free clinic in North Minneapolis to get prenatal care. They handed me a tiny slip with their number on it. Within 30 minutes, I was speaking with someone at the prenatal place right there, face to face, gave me a basic care package, toiletries and things to that nature. I received a good job. I moved into a place. I did not receive maternity leave funds from my job, given that I was just starting once I had my baby. I got with Healthy Start in a family partnership. They signed me up with a grant that was able to keep me home with my baby for the 6 weeks that I needed to be. They paid rent, they helped with food, diapers, light bill. I mean, anything that I can possibly ask for at that particular moment, I received it from them so I could be able to stay home with my son and give him the attention that he needed for at least the first 6 weeks. I think of this place as a lifesaver. If I have any issues, I'm able to call these ladies and be able to talk to them to, be able to get support, to be able to get counsel. I see them help so many women with their weekly support groups that they have for other ladies. I've seen the projects that they had with Josh and the men's project that my child's father also went a part of. He's a very quiet person, and Josh was able to set him up with resources and things as well to help him become a better father to his child as well.
Wonderful. How old is your baby now?
He'll be 18 months in July. I don't really know how that works, but there it goes. He was born New Year's Day, 2017. And, I was just moving back here to Minneapolis when I got with this crew, and they have been nothing but the best to me. Anytime I call, anything I could possibly ask for as far as support, encouragement, love, I get it from these women here.
Well, wonderful. Thank you so much for being here and letting us know. I think we might have a question for you, Councilmember Jenkins.
Yeah, thank you, Chair. I'm curious. So you mentioned that there was a grant for 6-week maternity leave. Were you able to go back to work then?
Once my 6 weeks was up, I was able to go back to work. I just wasn't there long enough to receive the maternity leave benefits from the job.
But your employment was still waiting for you when you returned?
I was just like on unpaid maternity leave.
Okay, wonderful. Where do you work?
U.S. Bank, right across the street.
Awesome. Very good.
But they just was changing policies and things within themselves. So as when a few years ago they was giving people maternity leave as soon as they got there, now you needed to be there a year to receive the benefits. So I got caught in the change of policies and procedures, but from the blessings and from this place here, that was the only reason why I wasn't back at work within a week or two.
Wow. Well, thank you for sharing your story. It's fascinating. Thank
I
you.
do appreciate it. Thank you for listening.
Welcome.
Alicia, thank you so much. And her partner, Daryl, was not able to be here, but he also, as she mentioned, received some fatherhood services through the Father Advocate, and I'm going to talk just a tiny bit about that. I wanted to mention, too, the second bucket of work are these culturally based programs, and we, again, contract with community partners to provide these services. One in particular, I think, is very timely. It's called the NINDY Project, and NINDY means My Heart in Ojibwe, and that's focused. It's a culturally based doula service for American Indian women who are struggling with opioid abuse and other substances. The next bucket of work are all the things that we do around school readiness. Our primary partner is the Minneapolis Public Schools, and our goal here is to screen all kids by age 3. So the primary or the prior focus was to screen them before kindergarten, but you probably know that that's too late. So we need to find as many kids as we can, screen them before 3, and then provide the services that they need. So in 2017, through the Minneapolis Public Schools, we were able to screen about 4,600 children and about 1,700 3-year-olds, and we're continuing to try to increase that percentage every year. We also provide outreach around school readiness through partners like Way to Grow, with a specific emphasis in the Phillips, Powderhorn, and near North neighborhoods. And we provide dental services for uninsured children. About 1,500 uninsured kids received dental services in 2017. Our last bucket is teen pregnancy prevention and teen parent support. So you know that we have a school-based clinic program, which I'm not going to talk about now, but hopefully you've had or you will have more of a presentation about that work. But our school-based clinic program provides resources to combat teen pregnancy. But we provide services for teen parents to try to reduce or prevent a second pregnancy, and also to support the teen parent. So we've got a special home visiting program funded by TANF for women under 21 years of age, a Teen Hope program, and again, this is through MVNA, for pregnant and parenting teens who are choosing the educational track. We work with the Minneapolis Public Schools and provide funding for a sex ed curriculum called Making Proud Choices. And then also our Youth Power initiative is a peer education program for 13 to 21-year-old East African youth in Minneapolis.
So I
Yes.
just a question on that. Is the teen pregnancy rate going down or up, or
Yes.
what's the trend line and how?
It's very much going down. Yeah, and I can't quote you a statistic, but I can follow up. But yes, we're seeing quite a decline in teen pregnancy.
And are we also tracking that based on race or class?
Yes.
Okay,
Yes.
so it might be interesting to see that. And I was also curious about the infant mortality rates. I mean, the gap was alarming and concerning. Is the gap widening, or is that also trending down, or do you happen to know?
It depends. Over time, I mean, I've been working in maternal and child health for a long time, and certainly infant mortality has decreased over that time, but for certain populations, it seems to stay rather stable. And I would say so for the African American population. We initially, when we first started Healthy Start, which again, it's an infant mortality initiative, it was for the African American population and also the American Indian population. And so we have a very small American Indian population in Minneapolis, but we were seeing infant mortality rates fluctuating. We have an opportunity to apply for the next round of Healthy Start. It's a 5-year grant. And so we're going to be looking at those rates to kind of figure out who we should focus on with our next grant proposal, which we'll be working on that in the fall. We have seen a little bit of an increase in infant mortality rates for the Hispanic population, but I can follow up with more information if the committee is interested.
Now, the vision says infant mortality is a thing of the past. I'm going to assume that 0 infant deaths annually is pretty unlikely. I mean, given some of the
It's
neonatal issues and
Yeah.
concerns and prenatal and that.
yeah.
But it would be, I guess, to get to that vision and to make it more reality, would take the drilling down to figure out what is exactly the problem is.
Exactly.
Why do we have?
And Chair Gordon, yes, yes. And so drilling down is the right way to look at things. So the city, through, I think it was a Results Minneapolis process, looked at infant mortality a couple of years ago, and especially in the African American community. And the big issue there is prematurity, babies born too soon, too small. And the part of the reason for that is all the stressors that families feel around the social determinants of health, like lack of housing, mental health issues, et cetera. So we do know something about what's happening with infant mortality in our community. I'm going to talk about this in a little bit, but we had a legislative proposal, which I think is still part of our platform, to look at an infant mortality review process where you actually study infant deaths, individual infant deaths, and try to, peel back the onion to see what caused those infant deaths and then make recommendations. So what happened is that the state, the ability to do that on the local level sunsetted. That was in the state legislature, and we're trying to get that back in statute.
So how many infants die a year in the city of Minneapolis?
Yes.
How many of our babies don't make it to and it would be within the first year?
Right, within the first year.
Do we have a number?
I don't have that on the top of my head, but I'm wondering if my staff, Kristen or Stephanie, or I see Gretchen's looking through her materials too.
Because it would be good to know. It's probably not tens of thousands. It's
No.
probably not thousands. And if we realized how few it was, we probably might be able to get our heads around
Yes.
why don't we have the resources to take care of those 125 babies or whatever it is. So you can look that up and we can go on with it. Is it more than that?
Oh, Gretchen.
Okay. We can get that later too.
Just to put it in context in your thought, committee members, Mr. Chair, Gretchen Musicant, Commissioner of Health, there was an effort at the state level to try and bring this amorphous, so many deaths per thousand, it just seems so out there, down to something that was more tangible. And in the African American community, I believe they said if we could prevent 10 deaths per year, we would close the gap. So
Right.
It's very tangible,
Mm-hmm.
and it's possible, and yet it's so important because infant mortality is a sentinel indicator of well-being. And so when we find out that the reason that we have low birth weight babies and higher infant mortality in the African American community, and that we learn that it's because of the stress that those women are in probably before they're pregnant, that is an indicator of well-being of our community.
Okay. 10.
We'll get back to you on that. Sure.
So I'll let you continue. Sorry about that.
Okay. No, we welcome any questions. Something that we've mentioned a couple of times is a focus on fathers. And so in this picture are some Healthy Start participants, Mimi Thomas Davis and Deshane Cochran and their baby. What's their baby's name? Diana. So really, really super cute. But I mention them because some of our Healthy Start participants had access to the services of a father advocate. And we had a grant through, it's a federal grant and it just ended, called Focus on Fathers. We had an opportunity to really learn some things. And the first thing that we learned, and we probably knew this beforehand, is that despite dad's desires to really be involved in the pregnancy and the postpartum period and raising their child, They're often left out of the process, and they feel ill-equipped to be new dads. Some lack role models for engaged and supportive fatherhood and need that social support and mentoring. So through this grant, we were able to hire a full-time father advocate, and this was again through the family partnership. And he really worked with a small subset of dads to get them the help that they need. And that help included parenting support. It included referrals for housing, food, employment, education, kind of those basic services. And what was exciting is that when dads got the help they needed, moms did better. And we found out that mothers were significantly more likely to show improvement on a composite scale of psychosocial risk. And not to put one of my colleagues on the spot, but I think this is a fascinating body of work, and it might be good to have a council presentation on that at some point. I think the grant has ended.
Oh, great.
We also work through many partners, and so here's just a subset of some of our partners. These are primarily contracted partners. I think the other piece for us is community involvement. And I wanted to mention a community action network that's part of Healthy Start. It's a grant requirement, but I'm so happy to have that requirement because it enables a group to come together, and Alicia comes to these meetings as a Healthy Start participant, as do other Healthy Start participants, and sits down with providers, folks from health plans, public health, the state health department, to really wrestle with issues like fatherhood involvement, mental health for pregnant and parenting families, housing instability, prematurity. And it's been a great group to be a part of, and we really take into account what they're telling us and try to change our program as a result. Now, some opportunities for council leadership. So as I mentioned, from time to time, we try to put some public policy issues on our legislative agenda and hope that our city will work on these. So something that we're really super interested in is what can we do around public policy and to engage more fathers. So the recognition of parentage issues. And so that might show up on our legislative agenda, or this, I mentioned the infant mortality review that is now sunsetted, and we're going to try to get it back into statute. So we'd hope that you'd be supportive of those sorts of public policy initiatives. The second piece is really helping us connect the dots. So, we don't, because we're the health department, we don't necessarily get grants to work on affordable housing or jobs for dads or for pregnant and parenting families or transportation. But, you interact with all these city departments. We're, hoping that you'll kind of keep us in mind and help us connect the dots so that we can better serve families. And then lastly, resources. A lot of this work is very heavily grant funded, and that ebbs and flows. And so we would look to you to help us continue to invest in this work, especially when grant funding is lacking. As I mentioned, we're going to go for the next round of Healthy Start, which is a highly competitive grant process. And I'm knocking on wood now. The next piece is just our contact information for myself and Stephanie and Kristen, and we'd be happy to stand for any questions.
Well, thank you very much. I think that I asked most of my questions. Any other questions? Vice President Jenkins.
Yeah, thank you, Chair Gordon. And I would just emphasize your previous statement about how all of these systems work together. I was particularly thinking about that when Ms. Musicant talked about, low birth weights and infant mortality, and how, issues like employment and housing, early access to healthcare, which you guys do help to address, but all of these issues work together to create general unwellness in our communities. And so I, for one, will absolutely be making sure that we're trying to connect those dots as we are talking about other issues that intersect with these ideas. So thank you for the report.
So Chair Gordon and Councilmember Jenkins, thank you.
So I guess I want to ask a couple more questions, and this is about infant mortality still. We used to be very concerned, I think, about the sudden infant death syndrome. Is that still an issue, or is that something we think there's been enough education and training and that doesn't enter into it much anymore?
It is still an issue, for sure. I think there has been a lot of education, but it's very much still an issue. I don't know if any of our staff want to, or family partnership folks want to talk about that, but safe sleep practices are super important.
And is there some little slogan or phrase we can
Yes,
say to
there
remind
is.
us about that?
Back to sleep.
And that
Yes.
sleep on the back,
Yes, exactly.
not on the stomach.
Mhm. Yep.
Okay, back to sleep. All right.
Right.
And I also am curious about neonatal care and premature babies.
Mhm.
Is there an issue in the quality of care that some people get? Maybe with the hospital that they can afford or the insurance that they have? Or do we think that no matter who you are and what your income is, you get the best emergency
I think
PICU care or
Chair Gordon,
Yeah.
excuse me. I think I think quality of care does vary. I am not an expert in that area since we're not so much, healthcare providers. We try to do the surround sound, as we call it. Does anybody else want to comment on that? Oh, here's Noya
okay.
Woodrich, who also has a background in maternal and child health, I believe.
Yeah. It's good to see you again, Mr.
Hi.
Rich. Hi.
Thank you, Chair. I think I've actually stood in front of Minneapolis City Council and spoken about infant mortality before. I wanted to get back to the sudden infant death question that you asked. There's actually some efforts amongst medical examiners to get away with that as an official diagnosis for death because they do believe that there is an explained reason for each infant death. However, in the American Indian community, still 50% of deaths are related to what they're now calling sleep-related incidents. So it could still qualify as an unexplained death, but by and large, it's a death that occurs during sleep, but it can be explained by some other factor that took place during the baby's sleeping period. Usually obstructed breathing, either caused by something in the sleeping area, whether it be another human or be a blanket or a teddy bear or something like that. So I just wanted to quickly say that about the sleep-related stuff.
Well, I appreciate that too, because there's an opportunity for some public education and information to go out from these meetings. So I want
For
it to
sure.
be accurate and up to date.
Yep.
Thank you so much.
Okay, does anybody else from the health department want to come up and say a few words?
Well, we appreciate you. Okay, I don't see anybody getting up, but thank you. Yes,
Oh.
Ms. Musican? Yeah.
All right.
More precision on healthcare. Again, this is Gretchen Music-Hands. We did a study called Periods of Risk. What is it? Yep. Perinatal periods of risk, kind of looking at what were the causes of the infant mortality and what can we think about in terms of strategies. And it did not reveal that healthcare is a weakness in this community. What it did show was that women's health before pregnancy is the greatest area, and then secondarily sleep. So those are the areas that we need to focus on. And so it is those social conditions that women are living in and that are present in our community and not evenly distributed.
Do you happen to remember how many babies are born a year in Minneapolis? So how many women?
6,000.
6,000. Okay.
There are 6,000 babies born, Councilmember Gordon, and about 3,000 are on medical assistance or healthcare programs.
Okay.
We did find, Ken found the number of infant deaths in the state of Minnesota, which I think is 357. And I was quickly trying to find, we have it on our website, the number of infant deaths in Minneapolis, but I just couldn't quickly find that. And it's not.
Well, we know it's going to be smaller than that.
Yes, exactly.
Okay. And so that shows us it feels like a more manageable number than you
Right.
might think. And when they talk about rates and all of that, it becomes pretty hard to get a handle on it
Right.
and pretty easy to think of it as not actual real people or something. But
Yeah,
if we think of
true.
individual, so I appreciate that. And I'll look forward to spending some time this evening Googling around and trying to figure out if I can find out what it is in Minneapolis.
Maybe
So-
I can get it to you before then.
Okay, we'll see. We'll have a race.
Okay.
All right. Thank you very much for the presentation. And we now have a quorum, so I think we can just move to receive and file this. All those in favor, please say aye. Any opposed? Thank you very much. And now we have one last exciting report that we've been anticipating. And this is a progress report from our Minneapolis Workplace Advisory Committee. And I think maybe Brian Walsh is gonna, or is Chelsea, are you gonna introduce yourselves, whoever's gonna make the presentation? And so glad to have you here. Hopefully
Couple of us.
you found that first part of the meeting entertaining enough.
Yes, and it
Take it
has
away.
some relation to our committee in a little bit, so maybe we should be here
Excellent.
more often. Good afternoon. Thank you, council members. Thank you, Chair. Thank you, Vice President Jenkins, for having us today. We're really excited to be here. I am joined with my co-chair, Jim Rauter, and one of our committee members, Veronica Mendez-Moore, to help out with today's report.
So glad to have you all here.
So up here, you have a list of everyone who's a part of the Minneapolis Workplace Advisory Committee. So you can see the depth and breadth of the organizations that are represented. And our priority is to work with workers who are directly impacted, with small businesses, with large businesses, with folks who are in the city enterprise and people who are working with nonprofits to really tackle the issues of what's happening in our workplaces in this city. A lot of things stem from what's happening in people's lives, and things that happen in the workplace impact everything that you're even hearing from these previous presenters. And so this seems like a simple one-sentence vision, but I assure you it took our committee probably a good 6 months of working with each other and getting to know each other and our importance, and working with council members and the city staff to come up with what our vision is. And that is to create strong communities where both workers and businesses are earning and thriving. And so now this came about while we were working on minimum wage, but this is sort of this is the beacon that we use whenever we're addressing any issue. And before we go too much on where we are now and where we're going, I've asked Jim Rauter if he would share a little bit about how we got to this point today.
Hi, good afternoon. I was also given the great opportunity to be the vice chair of the Minneapolis Workplace Partnership Group, which was kind of our first iteration. And we were put together by the city council to focus on one thing: earn, sick, and safe time. And it was a great collection of large, small business, workers, labor organizations, and community voices, where we came together and very effectively and efficiently we're able to put forth a recommendation to the city council on an ordinance in that space. And it was also, I think, remarkable that we were able to do that work in a very deep politicized environment for us with our group. And the vote of the Workplace Partnership Group at the time in support of that ordinance was 13-1-1, which I think was a great example of the collaboration. And again, the depoliticization, I don't know if that's a great word, but just taking the politics out of that process. And I think everybody has felt that ordinance has served its purpose well so far. And I think that's part of our vision as we look forward now that our committee is 15 strong again, also representing a great cross-section of all these different important voices from our community. And as we look forward to working on future issues that directly impact the workplace, I think that's part of our beacon and our vision is to be collaborative, to try to take as best we can some of the politics out, bring some really good analysis and some collaboration and some consideration to these policies, and try to make it work very well for all of us, and putting the city council in a better position to consider really, well thought out ordinance proposals and other policy proposals.
Yeah, and ordinance changes and implementation. And I think that, our role has been to really bring together diverse stakeholders, even beyond who's represented on our committee. Because when you look at the list of potential things that the city could work on as it relates to workplace, what's happening in workplaces, that list is long. Just paid family leave is one of 35 things that could be on that list that we're working on. So we're trying to balance the expansiveness and also focusing on the things that we can have the most impact on and bring the most direction to you as council members on. So you want to go to the next slide? So this talks about our enabling resolution, and this is the only slide that I think we're going to kind of look at more closely. The rest will just share some stories of what we're working on. And 1 and 2 are somewhat similar, where we as the commissioner, and not the commissioners, as the committee members who are connected to what's happening for workers and businesses, are bringing our expertise, our communities, our relationships to the table to talk about what kind of policies are important to our constituencies, what does work, and then also what kind of outreach and awareness is happening out there. The city has done a lot of outreach and awareness, but oftentimes the most trusted messengers are the people who are other fellow business owners or fellow workers who have access and those kind of things. So that's items 1 and 2. Number 3 is monitoring and evaluating the programs that are existing and future programs. Number 4 is, again, looking at that implementation and future programs that we could be looking at. And then 5 is creating the 2-year work plan, which we're finally wrapping up with the help of the city. So what does this mean? There's actually 4 main areas that we're working on. First of all is working on implementation and outreach. This is going to be ongoing through the entirety of the Workplace Advisory Committee in their existence. 2 is, this is where we find that we actually spend a lot of our time. At the end of the day, almost all of this comes down to enforcement. We can pass the best policies, we can have the best things on the books, but if we don't have a way to enforce or for workers and businesses to be collaborating, that's not going to happen. So we see ourselves often on the front edge of fighting for those resources. Everything comes down to resources. And interestingly enough, we've been able to be flexible enough to adapt to things that are happening in our environment. So I talked about that long list. One thing that didn't make that list was major events. However, when the Super Bowl started to roll into Minneapolis, our committee started paying a lot of attention to the Business Connect program. It was weeks after the first minimum wage increase came into play. So how did we know that all of these employers were going to be following the law? And then, of course, having the long-term vision of what's on the horizon, what's in the future. So those are basically what we've been to. And so the next couple of slides, we're just going to provide you with some examples of that work. And so Veronica, you were going to do 1 and 2.
Yes, so I can talk a little bit. Thank you for having us here today. It's good to talk to you all about this. So a lot of the work that we've been able to do is to do intensive outreach and education, both Situl really focusing on workers and making sure that, there are workers that for whatever reasons and with many different obstacles might never make it to City Hall to be able to file a complaint or to be able to even understand about their rights. And so we have a natural connection in that we're in communities that are the most vulnerable for exploitation and able to really do outreach to make sure that folks know their rights, and have also been able to pull together some conversations with some folks from Seattle, Rutgers University, National Employment Law Project, where they have been studying a lot of how enforcement has worked in other cities and how it could work, particularly in Seattle. And together we've been able to look at potential models and draw some lessons from those to be implemented here, learning from the successes that they've had in other cities. And then, and this is also work that's been done through mostly Main Street Alliance, but an important piece of this is doing the outreach to workers, but also, of course, is making sure that small businesses have access to both the information, but also resources to be able to implement the changes. For a large corporation who has a whole team of folks doing compliance, it's a lot easier to implement new rules. But for smaller organizations, it's just a really big added burden, and so it's really critical the role that the city plays both in doing the outreach, but also in support, in technical support to small businesses to be able to implement the new changes smoothly is just really critically important. And we've done some really good work on that, and there's more to do.
And I'll just reiterate right now, the amount of small businesses that even know about this ordinance and like they're not complying because they don't want to comply. The amount of small businesses that even know that this is in existence is minuscule compared to the amount of businesses that are operating in the city. So our committee is working really hard to raise that as an issue for you all and for our work as a priority going into this year.
Great. And I think another area that we wanted to point out today is the work being done by the committee with regard to in partnership and in support of the Department of Civil Rights as they develop their enforcement strategies and education and outreach strategies to the community. We actually are more than willing and much to their chagrin sometimes get a lot into the details with them about all the FAQs that support trying to educate, for instance, on sick and safe, other enforcement strategies that they're putting together, other educational outreach, that the information that is going up on the website with regard to these workplace policies. And we were able to give a lot of real-time feedback to them, not just through the members of the committee, but we're utilizing our connections to our own constituencies, as well as trying to bring other resources to the tables that some of us have. We've even had Target, employment lawyers and compliance people coming in and not only giving some feedback, but also giving experiences from, as we've talked about, for instance, Seattle, since we're an employer that does work in many cities throughout the country and have had experiences with very similar workplace ordinances at the local level. And deep dives and discussions around these issues, minimum wage, obviously more recently was an example where it was hard for us at the beginning when minimum wage was moving forward because the committee was very new and we were still trying to get ourselves organized. But once we did, we turned our attention to just a lot of the nitty-gritty details and trying to be there, quite frankly, not just as a sounding board, but as a support mechanism for, again, the department and the work that they're doing.
So, like I said, resources, it really all comes down to resources. So we advocate and fight for more resources to do this enforcement, whether it's hiring investigators, getting money into the hands of workers to go out and do this outreach, or small businesses. I'm kind of embarrassed. I don't have the number. Was it $825,000 that we asked for?
600,000.
600,000, and maybe that's this year's number preview for you. So we put together, based on what's happening on the ground and what we've seen in other cities, and based on what's happening here, we are looking for resources to fund this work. So we get that in front of the mayor's office, and we'll get that in front of you all as well. And we'll work with your committee chairman and others to make sure that's appropriate for what we have hopes for this work. And that really shows what the priorities of the council will be, is looking at those resources going forward.
And those were all resources for the Division of Labor Standards?
Well, it's a mix of resources directly going to investigators and the department, but then also granting into small business outreach and to worker outreach, so that the city the city employees do a wonderful job at doing what they're doing, but oftentimes a business person doesn't necessarily want a city person overlooking what's going on in their books. And just like a worker may not trust a city official, especially depending on what industry or wage level they're in, to be the person. So, but the city does have a very important role in their investigators as well, which there's been a lot of discussion about at what point does it make sense for these two things to intersect. So we do have people who spend a lot of time thinking about that and have good advice on when those kind of things should be handed over and who should be filling which roles.
And you're talking about a budget recommendation that you're going to be bringing to the mayor?
Yes.
Okay. Thank you.
And this is what what Chelsea started out talking about is the work that we did last year in bringing this budget proposal. And last year we actually asked for, so there's a ratio that they found in Seattle to be a really helpful ratio in terms of like getting the most done with the money that they have. And so they have 23 investigators, which is obviously much further along than where we are, but they have 23 investigators and $2.3 million in money that goes out in community contracts for outreach and education to small businesses and to workers. And so what we asked for in the budget last year was 6 investigators and $600,000 in community outreach money. And so that ratio is a thing that they found to be really important in making sure that it's not weighted where we don't just have it all inside the department, but that there's work being done out in the community with organizations that are already in touch with folks that would need information.
Is there anything special about where they get that money from?
Yes, I think there's a much longer conversation to be had about where the money comes from and how we make sure that that money is ongoing and not just a one-time thing. But in Seattle, well, actually, National Employment Law Project has been exploring lots of different opportunities that could be possible in Minneapolis. Just to name a few things that have been out there, there is increasing the fee for business licenses by a small percentage across the board. Their ideas have been like a penny per hour per worker worked that an employer would pay into a pot into the city. So sort of like a dedicated funding source that goes through the city. And so those are a couple of things, and there are a number of different ideas that we've been trying to get creative about to figure out where the funding could come from to make sure it's as successful as possible.
I appreciate that. I think that's a good strategy. I think people are going to pay attention to that, and having it tied to something like that might make it more palatable. I can't speak for the full council or the mayor, of course, but at least for one council member.
Yeah. Yes.
Yes, those discussions are happening.
Yep.
And then we're on to wage theft.
Wage theft, yes.
Or the future.
The future. Well, a little bit on the work that we've done around wage theft. I think that the outreach and education has really helped us to be able to prevent some wage theft, and also be able to help folks identify it where it's existed so that they can make complaints. We've seen the Civil Rights Department do some incredible work in recovering some tremendous amount of back wages. There was a case that was in the Star Tribune of a worker at Metro Petro. I think it was $11,000 in back wages that were able to be recovered because there were penalties because this employer was just willfully violating the law, retaliating against a worker. And so the department did a really incredible job of digging deep and investigating. Another example of kind of like why resources are necessary is like that level of investigation and digging was really important, particularly in that case. So that's sort of looking at what we've done, and we've now started to really think about the future. So what's next on the horizon? Chelsea mentioned we could have a list of 35 things. I think we do have a list of 35 things that we could work on, but what we're really thinking about right now is wage theft. As we know it's a significant problem. It's a significant problem here. It's a significant problem across the country. The seminal study on big cities done by the National Employment Law Project found that of all of the workers that they surveyed, low-wage workers that they surveyed, 66% had experienced some form of wage theft in the previous week to filling out this survey and doing this interview, which is really, really significant. And on top of that, there were a lot high numbers around retaliation and things like that. So the Economic Policy Institute actually also reported that more money is stolen each year in wages than in property theft. And we think about the resources that we spend to try to stop property theft through police department and the other means, but we need to be thinking about how are we funding wage theft or anti-wage theft work and enforcement of those laws. And so that's a significant piece of the work, like Chelsea said, kind of coming down to the resources around it. So I think a piece of this that's really important and why we decided wage theft needed to be a focus too is that, we've recently passed the minimum wage increase in the city of Minneapolis to go up to $15. We all know that it was a lot of folks in the community that really made their voices heard, particularly low-wage workers, Black and brown workers that came into City Hall to talk to you all about why this was so important for their lives. And unfortunately, those same folks low wage Black and brown folks are the folks that are most likely to be victims of wage theft and that are most vulnerable to wage theft by their employers. And so if we're serious about equity in our city, then we have to be serious about actually making sure that this new ordinance is enforced across the board. Because otherwise, what we've seen play out everywhere else in the country is that this is the group of folks that's least likely to actually receive what they fought for. So that's why we think it's really important. A couple of next steps in that. One is to really look at the ordinance as it exists, and we've started some work on this, and look at where there are holes, where there are gaps in how enforcement happens as per the ordinance. So, for example, right now, minimum wage is $10. If somebody were making $12 an hour and they worked 10 hours and were unpaid, one would think they should be able to recover $120 plus if there are any fines or penalties. But unfortunately, the city doesn't actually have the authority to do that. Legally, one could go to court and do that, but the city can only enforce up to the $10 an hour because that's the minimum wage. So the city could get somebody $100 back even though they are owed $120. Does that make sense, or am I getting tied up? So the city can only enforce the minimum wage, not what your actual wage is.
And is that because of the way we wrote our ordinance, or is that from other law?
The state is in the same position. So the state of Minnesota is the same. It's the same issue. They can only enforce 965. Federal can only enforce 725. So we'd like to think about how could we shift that? How could we change that such that that the city is actually able to investigate and recover for workers what they're actually owed. So that's a thing that we've noticed as a whole. Another whole is the city doesn't actually have the right to enforce overtime. And so if people are not getting paid overtime, how do we make sure that the city has at least the amount of authority that on the state level that the state has? And then in addition to that, making sure people are getting paid what they're owed. So those are some of the holes we're talking about. There's lots of other other examples. But those are the kind of things that we're thinking about. How do we shift that? And so some of our next steps we'll be talking to different folks about what is potential power that the city already has legally, and how do we just think about that in a new way, and then explore if there are things that the city does not have the power to do, then what are ways that either we could amend an ordinance or create an ordinance, or just figure out down the road what's exactly the best path to make sure that the department has all the tools that it needs to really fight wage theft, and make sure that workers are being paid what they're owed.
Do we want to take questions now? Yeah.
Sure.
So I think we have some questions. Councilmember Schrader.
I just want to thank you all for your work. I'm really looking forward to your suggestions on wage theft. I've moved here from Chicago, where it's a huge problem, especially for those who are most vulnerable and not in a position to really bring it up. So I want to make sure that we can set a very high bar here in the city, and look forward to you all saying. Thanks again for your work.
Thank you.
I also really want to appreciate the work that you did for the minimum wage issue. That was a very challenging thing for the city of Minneapolis, and I think your help was critical to that. So thanks so much for the involvement there. I did have 3 things that I wanted to highlight, and of course I'm very curious to see what your list of 35 things and if they're rank ordered or all of that. So I'm going to ask about a couple of them. One of the things that I noticed in the presentation is that you highlighted working with the business navigator, small business support division in the coordinator's office. You focused on how you trying to give support and work with the civil rights department. But you didn't mention our community planning and economic development department, which handles all the business licensing, all the economic development efforts and support. And so I think there's got to be ways where we can help build some connections there and get some support there. I actually think someday we might want the business division, once it's up and running and it's clear what they're doing, to go there. And there's actually a lot of good work that's going on there supporting small businesses and micro loans, and there might be a way that to amplify kind of the carrot or the incentives or the positives over there to be a companion. So think about that as a thing to tiptoe into or look at for a resource and look to the council who could help you maybe make some connections there. I also noticed you didn't talk about fair scheduling. And if you remember our agenda, our Working Families agenda, we had 4 big things on it. And in my mind, that's one that was left undone. And of course, we went into that and we approached it before we had our wonderful advisory group there to handle these kinds of things for us. And so you saw how that went, I guess, for the council. I don't know if you remember any of that, but there were some dramatic moments in that
Because
whole
there was a
discussion.
front-page story that mentioned me in the context of that.
But that's an issue that I still think is an issue in the city of Minneapolis. I think some people really have bad schedules. There's no notice. They ended up getting sent home or called not to come in now. Your shift is now canceled at the last minute. Some people have to leave and then come back in a few hours because that's their next shift. And it's there are what most people would think of unreasonable expectations and unfair expectations put on people's schedules, and usually the lowest paid workers who are maybe even in need of that income more than others. So that's something to think about.
Well, it is on the list of 35.
Okay.
If that makes you feel better.
Number 3? No, just kidding.
Well, we haven't ranked them.
Okay, yeah. All right. Well, then this is just, because this is my chance where I get to give
appreciate it.
input.
We want to hear it.
So the last thing that I'm really worried about is the independent contractor problem. And maybe this leaks a little bit into that shared economy thing. I'm not sure. But I think there's a lot of instances, and sometimes I worry that
You and I are kindred spirits.
Okay, excellent. And sometimes even the minimum wage and some of these rules will be pushing some people to start to, where's my loophole? Where's my escape hatch? Oh, independent contractors. I can move it out there, and then it's not, I don't have to provide as much for the people who are working there. And a lot of that puts a really big burden on those independent contractors to take care of a lot of things. And sometimes I don't know that it's fair. And I'm not sure how we get to that problem.
I think that's something that certainly I have continually asked our committee to consider strategizing around with regard to, there are significant amounts of business being done in cities like ours that essentially, whether it was intentional or not, operate outside all of these types of workplace policies and ordinances. And so we do have to, I think it's incumbent on our committee to grapple with that issue, because to come up with well thought out policies that are certainly worthy of your consideration doesn't do much good if increasing amounts of business are being done in a way that, unless we get creative, really they're outside the strictures of those.
And to that point too, both for wage theft. So one of the big things that we also look at with wage theft is the city's ability to enforce independent contractor, people violating the independent contractor rules. So where we can align the city's enforcement with the state's enforcement, including independent contractor, is something that is on this list of policy considerations, which does allude to that. But right when you started talking about the on-demand scheduling, the thing that I wrote here is sort of that next layer. You know, this wage theft really supports all of the work that has been ongoing and ongoing. That next layer, when you enter into the discussion about, the on-demand scheduling, you're automatically also entering this gig economy discussion. So I think that is very topical, very top of mind for this entire committee. And at the end of the day, when we talk about wage theft and earned sick time and minimum wage, it all comes back to what's happening in both the gig economy and your scheduling. So everybody is aware of that. It's just sort of like, how do we take the next steps because when you take that on, you're taking on both of those things at the same time, which is very daunting. So I think we are the committee that can do this work with the support of the council and our departments. But we're working through that. Is that an accurate description? And then we are very eager to work with other groups, including the neighborhood groups. Main Street Alliance has been the sort of main gateway for us. And one of the small businesses was going to be here today, and that, so they could speak to that better. But there's other committees too, like the workforce development, that we really hope to have a relationship with as a committee. So we really appreciate any connections with those. And I'm really excited to hear this energy around these issues.
Yeah, the workforce development would be really good. Well, I appreciate that, and those are just some of my thoughts that I thought I'd share. I don't think I'm ready to necessarily give you any direction on that. I do think that it makes a lot of sense to look at a priority, and tackling wage theft is excellent plan. And you're not asking for us to approve of it or anything, but we appreciate that you're working on it, and I think it makes a lot of sense. Do feel free to reach out, I think, to any of us if you want assistance or you think we should be kept abreast in more detail separately of work that you're doing or issues that might come up. I don't see any other questions. So then I think the appropriate thing for me to do is to thank you very much for this wonderful presentation and all your good work, and to move to receive and file this report.
Thank you. Thank you so much.
All those in favor, please say aye.
Aye.
Any opposed? That motion carries, and seeing no further business before us, we are adjourned.